In this episode of Consumer Times, we dive deep into the world of cardiovascular biomarkers and why they're crucial for anyone with heart disease risk factors. Learn about the essential blood tests your doctor should be ordering, what the numbers really mean, and how biomarker estimation can help predict and prevent heart attacks and strokes before they happen. Whether you have high blood pressure, diabetes, high cholesterol, or a family history of heart disease, this video will empower you with the knowledge to take control of your cardiovascular health. Welcome to Consumer Times. I am your host Dr. Arun Kumar. It is known that the cardiovascular disease remains the leading cause of death worldwide, claiming millions of lives each year. But here's the good news. Many heart attacks and strokes are preventable if we catch the warning signs early enough. That's where biomarker estimation comes in, and today on Consumer Times, we're breaking down everything you need to know about these potentially life-saving blood tests. So what exactly is a biomarker? In simple terms, a biomarker is a measurable substance in your body that indicates the presence or severity of a disease. Think of biomarkers as your body's warning system, sending out signals that something might be going wrong long before you experience any symptoms. For cardiovascular disease, these biomarkers can be found in your blood, and they provide crucial information about your heart health, inflammation levels, and overall risk of developing serious cardiovascular events. Let's start with the biomarkers you've probably heard of. Cholesterol is perhaps the most famous cardiovascular biomarker. But it's not just about total cholesterol anymore. Modern medicine looks at a more detailed lipid profile that includes LDL cholesterol, often called bad cholesterol, HDL cholesterol, known as good cholesterol, and triglycerides. Your LDL cholesterol carries fat to your arteries where it can build up and cause blockages, while HDL cholesterol actually helps remove cholesterol from your arteries. The ratio between these different types of cholesterol can be even more telling than the individual numbers alone. However, cholesterol is just the beginning. One of the most important biomarkers that many people don't know about is high-sensitivity C-reactive protein, or hsCRP. This biomarker measures inflammation in your body, and chronic inflammation is now recognized as a major driver of cardiovascular disease. Even if your cholesterol levels look good, elevated hsCRP can indicate that you are at increased risk for heart attack or stroke. Studies have shown that people with elevated hsCRP levels are at higher risk of cardiovascular events even when their cholesterol is normal, which is why this test is becoming increasingly important in cardiovascular risk assessment. Another crucial biomarker is homocysteine, an amino acid in your blood. Elevated homocysteine levels have been linked to increased risk of heart disease, stroke, and peripheral artery disease. High homocysteine can damage the lining of your arteries and promote blood clot formation. The good news is that homocysteine levels can often be lowered through B vitamin supplementation, particularly folate, vitamin B6, and vitamin B12, making this a modifiable risk factor. Lipoprotein, often abbreviated as Lp(a), is a lesser known but incredibly important biomarker. This is a specific type of LDL cholesterol particle that's particularly sticky and prone to causing arterial plaque buildup. What makes Lp(a) especially concerning is that it's largely genetically determined, meaning diet and exercise have limited impact on it. If you have elevated Lp(a), you need to be extra vigilant about controlling other risk factors. Many people go years without knowing they have high Lp(a) because it's not included in standard cholesterol panels, yet it can significantly increase cardiovascular risk. For individuals with diabetes or metabolic syndrome, hemoglobin A1c is an essential biomarker that measures average blood sugar levels over the past 3 months. Poorly controlled blood sugar damages blood vessels and significantly increases cardiovascular risk. Even people without diabetes should monitor their A1c levels, as prediabetes is extremely common and often goes undiagnosed. Natriuretic peptides, specifically BNP and NT-proBNP, are biomarkers that indicate heart stress or heart failure. When your heart is working too hard or not pumping effectively, it releases these proteins into your bloodstream. These markers are particularly useful for people who experience shortness of breath or fatigue, as they can help determine whether symptoms are related to heart problems or other causes. Troponin is another critical biomarker, though it's typically measured in emergency situations. Troponin is a protein released when heart muscle is damaged, making it the gold standard test for diagnosing heart attacks. High-sensitivity troponin tests can now detect even tiny amounts of heart damage, allowing doctors to identify people at risk before a major cardiac event occurs. The newer frontier in cardiovascular biomarker testing includes markers like myeloperoxidase, which indicates oxidative stress and inflammation in arteries, and TMAO, a compound produced by gut bacteria that's been linked to increased cardiovascular risk. These emerging biomarkers are helping us understand that cardiovascular disease is more complex than we once thought, involving not just cholesterol but also inflammation, oxidation, and even our gut microbiome. So who should be getting these biomarker tests? Anyone with cardiovascular risk factors should discuss comprehensive biomarker testing with their doctor. Risk factors include high blood pressure, diabetes, smoking, obesity, family history of heart disease, sedentary lifestyle, and age over 40 for men or post-menopause for women. Even if you feel perfectly healthy, if you have multiple risk factors, biomarker testing can provide valuable information about your true cardiovascular risk. The real power of biomarker estimation lies in personalized medicine. Two people might have the same cholesterol levels, but one might have high hsCRP and elevated LP, making their actual risk much higher. By looking at multiple biomarkers together, doctors can create a much more accurate picture of your cardiovascular risk and tailor prevention strategies specifically to your needs. This might mean more aggressive cholesterol treatment for someone with high LP, anti-inflammatory strategies for someone with elevated hsCRP, or targeted blood sugar management for someone with prediabetes. It's important to understand that biomarkers are not destiny. Many of these markers can be improved through lifestyle changes including diet, exercise, stress management, and sleep optimization. Some may require medication, but the key is knowing where you stand so you can take appropriate action. Regular monitoring of biomarkers also allows you and your doctor to see whether your interventions are working. The bottom line is this: cardiovascular disease doesn't have to be a mystery or an inevitability. Biomarker estimation gives us a window into what's happening in your cardiovascular system right now, allowing for early intervention that can prevent heart attacks, strokes, and other serious complications. If you have risk factors for heart disease, don't wait for symptoms to appear. Talk to your doctor about comprehensive biomarker testing. Your future self will thank you. Remember, knowledge is power, and when it comes to your cardiovascular health, biomarkers provide the knowledge you need to take control and make informed decisions about your care.